Hello and welcome to this MedWine News podcast for Medicine Matters Oncology. In light of the growing COVID-19 pandemic, we spoke to lung cancer specialist Gilberto Lopes from the Sylvester Comprehensive Cancer Center in the USA about the impact of COVID-19 on the care of patients with cancer. Let's hear what he had to say.
There are many ways that we think the coronavirus situation is going to affect cancer patient care. The two main areas are, of course, the cancer patients that are higher risk of complications if they contract the coronavirus. And the second area is that as we may have difficulties with limited resources in healthcare, we may need to limit access so that patients don't get exposed to institutions that have large numbers of patients with the coronavirus.
What about the specific risk to cancer patients from infection with the new coronavirus?
Patients with cancer have higher mortality rates than patients who do not have cancer. And we have emerging data from COVID-19 suggesting that patients with cancer are 3 times more likely to need hospital care and intubation if they have the coronavirus versus patients who do not have cancer.
Are there any anti-cancer treatments or regimens that you're particularly concerned about?
It's still too early to know which particular regimens or treatments might be worse, but of course we should take precaution, and all patients undergoing chemotherapy or cancer treatments should be considered at risk.
What guidance is available with regard to the management of cancer patients?
Governments have included cancer patients in their high-risk categories for most evidence-based recommendations. And a number of institutions and societies, professional and patient groups, have come up with guidance. So it's actually relatively easy if you Google COVID-19 and cancer to find recommendations from Cancer Research UK, from the American Society of Clinical Oncology, from the American Society of Cancer, which actually is the American Cancer Society, pardon me. And for instance, in Brazil, the Brazilian Society of Oncology also came up with guidance, and we have examples of these guidances from around the world. So it is very likely that whatever language patients speak, they might be able to find already guidance in their native language.
What steps are you taking to mitigate the effects of COVID-19 amongst your patients?
Many cancer centers have started to have alternatives on how to care for our patients. Those who do not need to come see us physically may be able to have care through phone calls for follow-up visits. Of course, those that are on active treatment should continue them. We're not at the step in this COVID-19 situation where we should recommend that patients should stop their cancer treatment. They should definitely continue that. But there are guidance for patients who develop symptoms that might be flu-like or cold-like. And most institutions have set up phone lines and internet sites that you can check to see what you're supposed to do. In our institution in particular, we are guiding patients that are mildly symptomatic to stay at home and to call the office if they are feeling worse or if they're not getting better after a couple of days, or if they have any symptoms that might be worrisome, such as chest pain, shortness of breath, or high fevers. And if patients do have these symptoms, they're instructed to call our hotline to let our institution know, and we have made preparations so that patients who come in and are suspected of having COVID-19 can be isolated as not to spread the disease to other patients and to our staff. We're also starting to work on trying to change into televisits and to try to postpone visits for those patients who are not on active treatment. One specific mention that we should make is that patients who are on treatment should continue coming to the office and getting their treatment, but we will try to minimize visits in person for those patients that might be seen or might be cared for remotely.
And finally, what are the most important issues for you?
So the most important issue right now is that we do need to heed advice about social isolation. We should not be congregating groups of people. We should try to keep to ourselves and stay in social isolation as much as possible. We should not forget to wash our hands with soap, and if you don't have that, to use alcohol-based solutions. And it's important not to panic. We don't need anybody running into supermarkets and overstocking toilet paper or anything like that. This is a situation that will be minimized. We're not expecting to control and prevent the virus from reaching most communities, but we hope that we'll be able to delay its spread so that our healthcare systems are not overwhelmed by the number of cases. Thank you for the opportunity to get the message out, and have a good day and stay safe.
On that note, we'll sign off. Thanks to Dr. Lopes for speaking with us, and to you, our listeners, for tuning in. Until next time.